So because we want more thickness of our opaquer and composite to mask the intense discoloration at the root. So in that area we use a slightly darker opaquer to mask. We can do the same thing on an extreme case also. We can use a dark opaquer to mask. First give a thin layer and then cure it. But you have to cure each layer because the opaquer doesn't allow much light to pass through. So you have to give thin layers and you have to cure for more time. Now in an extreme case, you have to neutralize that color. So you have to use what is called as the pink opaquer. Okay. Now this is not actually pink, it just has a pink hue. But it is the only thing in the world that will mask off a severe discoloration. You can also mix it. The other secret is when you put your composite with an instrument, you can see there is some composite on the instrument at the tip. Can you see that? Now if I touch this composite with it, that composite will come off the tooth because it is attracted cohesively to the composite on my instrument. So when you put it, before touching it again, clean the instrument. You can use a piece of gauze and then you can just tap and pat your composite. And spread it from the center upwards, downwards and sideways. Now in the cervical area, you will need a thicker layer to mask. So most of it should be first put in the cervical area and then spread downwards in a thin layer. Now you can create your mamelons. See that you don't put this incisally because we want incisal translucency, and that you will achieve only with a transparent composite or a microfill. Now after you finish with each layer, it is to be cured. So we cure our first layer, which is put on top of the opaquer. And the light I am using, if you see, has a very short tip, so there is no loss. It will cover the entire area of the tooth. Now the next layer we use is incisal. IL stands for incisal light. That is used in between the mamelons and in the incisal area and on the sides. Again same thing, we take it on the instrument, put it in the incisal area only and then spread it in between the mamelons basically and keep it on the incisal edge and in between the mamelons.